Main advantage in my opinion is that it allows cherry picking of hair. Advantages and disadvantages of FUE over FUT. The main advantage of FUE is that it is less invasive. Less invasive means relatively more comfortable for the patient. Less pain, less swelling, faster recovery time, and less overall complication rate. So that is the most important advantage, and that is why more and more patients and more surgeons are moving towards FUE. Of course, there are no stitches, so you don't need to remove the stitches. There's very less chance of infection. Pain is less, and all we have discussed that. Second main advantage in my opinion is that it allows cherry picking of hair. So now suppose we do an FUT procedure, we are bound to utilize all those hair that we get in that strip. Even if there are certain hair which are thin, not very suitable for hair transplant, we still have to use them. Whereas in FUE, you can selectively leave these hair, hair follicular units which have single hair, follicular units which have really thin hair. You can just leave them. If the person wants not to use gray hair, you can leave them in FUE, which is not possible in FUT. So that's another advantage, is that cherry picking of hair roots is possible in FUE. Third, sometimes is that because the overall scarring is comparatively less. FUE is not a scarless procedure. It does give you very small tiny dots if done correctly, but by and large it looks okay. So if a person really wants to keep short hair, then it may be possible to do that with an FUE procedure, particularly when the procedure is small, 1500 to 2500 grafts, which may not be possible in FUT because of that thin linear scar. This is an ambiguous advantage, but yes, it works sometimes. So in my opinion, the main advantage of FUE is that it is less invasive. The disadvantages of FUE is that it is more time consuming for the surgical team, so slightly more costlier for the patient. Thirdly is that when the graft requirement is a lot, which is 3500 grafts or more, and in an average donor area, the surgeon tends to wander into the non-permanent zone sometimes, which is a relative disadvantage of FUE. Third is that your second procedure becomes slightly more difficult, particularly in inexperienced hands. If you are opting for a second or a third procedure, if you have already got an FUE done, that becomes slightly more challenging for a, let's say, not so experienced surgeon. Whereas if your first surgery was FUT, the second procedure becomes a bit easier because you have a lot of virgin areas. So if given a choice between FUT and FUE as the first procedure, we tend to prefer FUT, but as I told you, there are so many less takers for FUT now. So yeah, that's another disadvantage of FUE.